Hi guys, welcome to Healthy Living with No Small, the channel where health finally makes sense. Welcome to this week, and this week we are looking at a different health condition. In the previous series where I talked about hepatitis, I did link it to leading to liver cirrhosis, liver failure. And so this week we're going to talk about liver disease. Okay, so come with me as we discuss liver disease. Did you know that the liver performs about 500 vital functions daily? That's right. It helps with digestion, it helps to filter out toxins from your blood, it helps to store energy, it produces protein that helps with blood clots. Okay, so again, it digests food, stores energy, filter out toxins, okay, from your blood, produce protein that helps with blood clot. Yet millions of people have liver disease and they don't know it. And like I said in my previous video, when I talked about hepatitis, viral hepatitis, the liver does a lot of things in our body. The function is a lot. 500 functions daily is a lot. And so when the liver is not working right, the body system begins to shut down because your food can be processed normally. It can filter out toxins. You're retaining fluid as well. Now, what is liver disease? Liver disease isn't just one disease. It's a broad term that's used to describe when there's a damage to the liver or anything that prevents that liver from performing its daily functions, right? Now, think of your liver as your body's chemical processing plant where everything is happening. And so when the functions are not when that plant is not able to perform its function, your body begins to shut down in different areas, right? Now, if the liver is repeatedly injured from whatever the risk factors are or from whatever is causing it, right? An healthy liver tissue will become or will be replaced with a scarred tissue. And this scarred tissue would lead to liver failure. Okay. When that tissue is severely scarred, it can lead to liver failure. Now let's talk about what's causing this liver disease. We did talk about in my last video, I talked about hepatitis, right? Now, hepatitis is one of the causes of liver disease. Okay. Viral hepatitis is one of the causes of liver disease. Okay, which means hepatitis means inflammation of the liver. Okay, and again, we have hepatitis A, hepatitis B, hepatitis C, D, E. Okay, now the ones that are most that can live in your body for a long time and can even lead to liver cirrhosis, liver failure, hepatitis B, hepatitis C. Okay, now we have treatment for hepatitis C, we have vaccine for hepatitis B, okay, and also for hepatitis A. And these infections can damage the liver cells and in some cases lead to long-term complications. And again, like I said, hepatitis can live in your body for so long that you would not know that you have hepatitis unless a routine blood work is done to check it. Now, the second cause of liver disease is fatty liver disease. And what does this mean? This is the accumulation of fat within the liver. Majority of people are suffering from fatty liver disease. And this is not just in one continent, it's worldwide. It's the fastest growing. And this is just fat accumulation inside the liver. And there are two major types of fatty liver disease. One that is caused by alcohol. Okay, this is alcohol related fatty liver disease. And there's another one that's caused by our metabolism, right? I'm not going to go into the long name that it's called, but it's basically caused by the metabolism. So it's linked to obesity, it's linked to diabetes, it's linked to insulin resistance, metabolic syndrome. Okay, so some of the things that causes that metabolic type of liver disease, fatty liver disease, obesity, diabetes, insulin resistance, and metabolic syndrome. Okay, now the other type of fatty liver disease is caused by alcohol. The consistent long-term dependence on alcohol can kill the liver. Okay. Now, the third cause of liver disease, can we guess what that is? Like I just said, alcohol. Okay. Long term use of alcohol and excessive use of alcohol can scar the liver tissue. It can inflame the liver tissue, can cause scarring, and eventually lead to liver failure. Number four cause of liver disease is genetic disorders. Okay. Some liver disease exists in the family, it runs in the family, okay, which includes Wilson disease, hemochromatosis, and some other disease. It runs in the family. And if it runs in the family, again, there's nothing much we can do about genetics, okay, but we can always change our lifestyle. We can always eat healthier. We can always choose healthier options as we live through our daily lives. What are the signs and symptoms of liver disease? As a nurse, one of the most important things that I will tell my patients is that liver disease can be silent for years and it could just live in your body without you knowing it. And some people have no symptom at all. No. And when the symptoms do appear, some of them will include jaundice, which is yellowing of the skin, yellowing of the eyes. Okay. And this is caused by the buildup of bilirubin in the body. Okay, this is caused by the buildup of bilirubin in the body. And what is the liver supposed to do? The liver is supposed to filter out the toxins, right? But now there's a buildup of bilirubin, and that is now showing on the skin and on the eyes. So fluid accumulation in the abdomen, which is called ascites or swelling in the leg, is another symptom, signs and symptoms to look out for when it comes to liver disease. Easy bruising. Again, remember that the liver is supposed to help build proteins to help with blood clot, right? That's what the liver is supposed to do. However, in this event, when that is not happening, we are easily bruised. Liver produces clotting proteins, right? Clotting protein. And then when it can't do this, when it is damaged, bruising and bleeding becomes more common, okay? When that clotting factor that the liver is supposed to produce is damaged, bruising and bleeding becomes more common, okay? Changes in the color of the urine, dark urine, okay? Pale or clay colored stool. You can look out for dark urine. When you see that it's darker than normal, it's darker than usual. It's not like, oh, I didn't drink water and then my urine, it's darker than usual. Okay. Pale or clay colored stool is another symptom, signs that you need to look out for. Fatigue, consistent and persistent fatigue, just being tired, just fatigued from your body, is another sign and symptom of uh, liver disease. Now, it doesn't improve with rest. Even when you rest, if you're fatigued and you say, okay, let me take a rest, and you still wake up and you're still fatigued, you're still very tired, you need to see your doctor, you need to do a checkup and just make sure everything is fine. Doesn't necessarily mean that you do have liver disease, but it's okay to check on yourself, okay, to do a medical checkup. Severe itching can occur when the bile flow is impaired. Okay. Again, the bile flow, the liver is supposed to be doing all of that. But if the bile flow is impaired and these toxins are staying in the body, we're not filtering out as it should, the body is not processed, the liver is not processing as it should, there will be severe itching. Other symptoms will be nausea, loss of appetite, weight loss, okay, as part of it. Just unexplained weight loss are also signs and symptoms that the liver disease is progressing. So it's very important that we see the doctor. Let's talk about the different stages of liver disease. This is where many patients get confused. And so I'm going to break it down to you in a way that you would understand. The first stage, what happens? There's inflammation of the liver. Okay, it's irritated, it's inflamed. Second stage is fibrosis. So, stage one is inflammation, irritated, and inflamed. Stage two is fibrosis. Healthy liver tissue are being replaced with scarred tissues. So, now there's fibrosis. Okay. Stage three is cirrhosis. Now, liver cirrhosis, extensive scarring has developed and liver functions become impaired. Now, at this stage of the cirrhosis, there's an extensive scarring and then the liver function is now impaired. Okay, so that's something to know. Now, stage four is where we have liver failure. Stage one, inflammation. Stage two, liver fibrosis. Stage three, liver cirrhosis. Stage four, liver failure. When a person has liver failure, this is where the liver cannot perform its functions as it should. The liver is not able to keep the body healthy anymore. And most people think this is, liver problems are caused just from drinking alcohol. No, that's a myth. It's not just from that. And like I've said, you can have hepatitis and it would lead to liver disease. You can have fatty liver disease, which is can be metabolic, can be alcoholic. You can have autoimmune diseases that can lead to liver failure. And you can also have genetic disorders that can all cause liver cirrhosis. Okay. So remember that this scarring of the liver tissue is not just caused by alcohol. There are other things that are involved in it. Let's talk about how liver disease is diagnosed. They are called liver panel tests, right? The blood tests, we have blood tests that can be used to check for any liver damage: AST, ALT, bilirubin, PTINR, albumin. Okay, and the levels of these things in the liver is used to determine if there's a problem with the liver or not. When there's a liver damage, AST and ALT may be high in the blood. And so when they're high, that can indicate that there is a liver issue or there's a liver damage, right? Because they shouldn't be high in the blood. So when there's a liver cell damage, AST and ALT tend to be high in the blood. And that can just indicate liver um, issues or liver damage. Now we also have bilirubin, right? So bilirubin is a waste product that's processed by the liver. Okay, and so when it's high in the blood or when it's high in the body, it causes jaundice. Okay, and that's when you start seeing that yellowing of the skin. So when they do that test and they see that it's high, it can be an indication that there's a liver problem. Albumin is a protein that's produced by the liver, right? So when albumin is low in the blood or in the body, it can indicate a chronic liver disease. Okay, it can indicate that there's chronic liver disease. Okay, so those are what those tests mean. Now PTINR is used to measure how long it takes your blood to clot. Those are the tests, the blood tests to look out for. We also have some imaging that we do: CT, MRI, ultrasound, and this can help to identify inflammation, fatty liver disease, tumors, and scarring of the liver. There's also liver biopsy. I've seen a lot of patients that have had biopsy, okay, just to rule out liver cancer. So they do the biopsy to have a definitive diagnosis. Now, can liver disease be prevented? Yes, it can be prevented. And remember that genetics is something you can change. Age is something that you can change. But what you can change is your lifestyle. What you maintain a healthy weight, manage your diabetes, okay? Control it. Limit alcohol consumption. Alcohol consumption should be highly limited. Get vaccinated when it comes to the viral hepatitis. Okay, if you know that you have hepatitis, get vaccinated, get treatments, okay, when needed. Avoid sharing needles with anyone. Avoid sharing needles with anyone. Remember that the hepatitis can be transmitted by sharing needles, blood, body fluid, food, water. So be very careful. Use your medications responsibly. Do not overuse. Again, a lot of people take pain medication to the point where it destroys the liver. Because remember that your liver is processing your medications. And when you're giving that liver too much of that particular medication, if you notice when you take the pain medication bottles, Tylenol, whatever the medication is, they tell you and they warn you to be careful, and they give you a dosage to use within a particular amount of hours. Okay. And it's important that you're not just self medicating, you are speaking to your doctor, and it's been prescribed to you that, okay, whenever you have this, take this at this time. Keep regular health care appointments. See your doctor regularly. See annual blood work, annual wellness check is very important. And if you have elderly people, please make sure that they're doing their annual wellness check. Make sure they're seeing their doctor, they're taking their medication as they should, and not overusing it or underusing it or avoiding it. Early detection often prevents permanent liver damage. So it's important that as soon as we were doing all these routine checkups, annual wellness check, and so when they detect it, they're able to address it as quick as possible to prevent any permanent damage to the liver. The liver is one of the most hardworking organs in the body. And I don't think that a lot of people do know this. The liver is one of the most hardworking organs in your body, but it can suffer in silence. It does a lot of work. It will suffer in silence until it can't take it anymore. And what happens? It gets to a point of shutdown. And remember that the liver disease has stages, okay? So do not let it get to the point where it leads to a liver failure, liver damage, liver cancer. We don't want that, right? Now, understanding the causes, the symptoms, progression of liver disease, and just knowing how your liver works will help you recognize any signs and symptoms, or if something is wrong with you, it would help you identify it so you can get treatment as early as possible to avoid any permanent damage. Okay, now if you found this video helpful, please subscribe, subscribe, share, leave your comments, okay? And I'll see you in my next video. Thank you and stay healthy, stay informed.